58-year-old female presented with the complaint of melena and altered bowel habit from last 6 months. On DRE, anal tag was present at 6 and 12 o'clock position. Proctoscopy was normal.
Thank you very much. Right, my friend. So what are we going to do? Did you hear what she said? Altered bowel habit, collapsed stool. 6. Yeah. She's got hemorrhoids, appendicectomy. What did I do to you? I distracted you on purpose, but I heard her. I'm a one. I'm a one. Yeah, so put there and how's that? Ah, you see. No surprise attacks. Whew. So 2-2. 2-2. Tell her what you're doing. Tell her what you're doing. Yeah. So the reason why he's already told her, but then there was a big pause in between him actually doing something. So even though you've already told her, it's courtesy to still let her know and say, I'm doing it now. So we're having a happy day today. Happy day. Happy day. Happy day. Sorry. My grandchild. Just thought I'd let you know. Born yesterday. Girl. No doubt she'll be bossy. Tell her. Good man. Well done. Good. Are we going in or are we coming out? Good man. So, 30 minutes. 30 minutes. Good man. So I don't know if you're looking at the screen, but this is a lady with PR bleeding, and we've just lost the image. Freeze where you are. Wait. Freeze where you are. Now he's not moving. Advance. And so the stool that you can see is normal colour. So this is something that helps you a little bit. So there should be no active bleeding at the moment if there is anything proximal to where we are. See where the liquid has come from? You can actually look at where the stool is coming from. So you can see the lumen is actually off up at the top. Now he's rotating the scope a little bit too much. Chill. Drop your hand and rotate the scope here. Straighten. Straighten. Bend. That's it. There, see? And tip up. So just by straightening your arm actually opens up where the lumen is. Now he's wondering how that happened, and he needs to pull the big wheel back slowly, slowly, ever so slowly. Good. You're pushing blind. That's pushing. That's pushing, not advancing. Do you see where you're going? No. Can you see where you're going? No. So where are you going? So draw the scope back. Withdraw. Slowly. Right. Now you can see where to go. Chin down. So head down. Forward. Up. Get your finger off the air. Get your finger off the air. Get your finger off the air. I'll strap 'em. Sorry? Okay, let me just show you, and then I'll hand it back to you. Let go. Hand the scope. Right, so you just stand here. Right. Hold the scope so it's relaxed. Here. Off. Okay? Look at the lumen. You're too busy messing with this. This actually steers you. See it? No air. As you go forward, see the folds as they come up. And then tip up. So tip up as you go forward. And then she goes round. See it? And tip up. All it is pointing the tip and tip up. Big wheel back. Tip up. Look at the folds. The folds are doing this, and the teeny eye is actually pointing this direction. So you get the tip of the scope in line with the teeny eye, and then up. Good. Good. Oh. Look at the folds. It's going this way. Oof. Good man. Nice and slow. Good. Better. Where do you think the lumen is? Stop where you are. Where do you think the lumen is? 12, 3, 6? 6. Good. So you know what to do. You just need to know where it is. You can stop. Stop. Freeze where you are. Now look down how you got the scope. No. Look at this. You don't need to bring the scope up and up here. I'm over here. You're not a cowboy. It's not a lasso. Yippee-ki-yay. No. Nice and slow. Good. Where do you think the lumen is? Where do you think the lumen is? More 9. Come back with the scope, a fraction. Now tip up. Now where's the lumen? So now you stop blowing air, you can see what's happening. Yeah? So where's the lumen? So where's the lumen? Sorry? No, don't let me see. Know where the lumen is. Where is the lumen? Stop. No. Okay. Look up. Tip up. Slowly. Tip up slowly. Clockwise torque. Slowly. Just clockwise torque. Stop. Draw back the scope. Draw back. Where's the lumen? Sorry? 12 o'clock. Yes. So you shouldn't. Why did I say to you? Just stop a moment. Why did I say to you, where's the lumen? And you said, let me see. Why did I say, no, let me see? Why did I say that? Because you were pushing blind. We don't push, we advance. Okay? So there's no point in going forward if you don't know that's the direction to go. Nice and slow. Nice and slow. Good man. Good man. Nice and slow. Stop blowing. Nice and slow. Nice and slow. Nice and slow. Nice and slow. Good man. Nice and slow. Keep going. Take your finger away from the blow. Good. Now where's the lumen? Sorry? More 4. Look at the teeny eye. Which direction is the teeny eye pointing? Come back with the scope, and you've put a clockwise torque on the scope at the same time. Come back with the scope. Now where's the lumen? See? Advance. Nice and slow. Nice and slow. Now, advance 2 centimeters. Bring the scope up slowly to here. Clockwise torque. Clockwise torque. Apply the torque. Good. Draw back the scope slowly. No, not yet. Draw back the scope slowly. Now a little bit of air, just a little bit. Good. Now anti-clockwise slowly. And tip up. And you'll see where the lumen is. There you go. Can you see it? Can you see it? Right, you need to talk to me, my friend. Because if you don't talk to me, I think you don't understand. And if you don't understand, I'll hassle you even more. Nice and slow. Where's the lumen? Stop. Where's the lumen? Stop. Where's the lumen? No. A little bit of air. Now suck. It's not 1 o'clock, is it? It's not 1 o'clock, is it? So you were guessing. Don't guess. Okay? Don't guess. If you guess, you might as well not do any investigations for the patients. You might as well just look at them and say, this is what's wrong with you, and go home. Yeah? Whoops, we lose an image. Good. Clockwise torque. More. Not up. Clockwise torque. Stop. We keep losing image. Okay. Let me just have a look for you, my friend. Let's stabilise the scope for you. You've done really good, okay? What I'm worried about is the fact that we're losing image. See here. Watch what I'm doing with the scope. See here with the scope. You're reluctant to actually use the scope. See the motion? Right? So now we know where we are. I've not done anything but take the air out. Watch. This is what I want you to do. Right? Clockwise torque. Whoa! See the teeny eye in the middle? Tip up. Yeah? Nazim, where's he gone? That's going to go again. It's the image keeps disappearing and it makes it unsafe for somebody to... Needs to be... Okay, let's just have a look at this one. Not your fault, my friend. Okay? See how we tip under the scope, under the folds? Yeah? Stare at that monitor. That monitor's unsafe. Advance. Good man. Good man. Good man. Nice and slow. Advance. Nice and slow. Sorry? There is no loop at the moment. Just advance. Okay? Advance. That is... Turn at this one. That needs to be sorted, my friend. Hit it. Oh. Tip up. Tip up. Clockwise torque. Oof. Who's turned this off? Do you not know that I die? Wasim! I'm dying. You see, she dropped you in it, Wasim. Okay. Let me just do that for you just to get round, because that is unsafe. Okay? So when you're here, like this, it's very difficult. So you're looking over your shoulder, not the best thing to do. See what I did with the air? Is that sorted now? Wasim, is it working? Are you sure? You turn my fan off.
Actually, that is off. Now I'm starting now.
Is that on now? Are you looking after me? Wasim, that is not working, man. Cable.
How do we recognize the transverse colon?
See how the teeny eye is swung here? This is actually looking proximal descending colon. So as you come round here, see how it's round like your hand, like this shape? That is transverse colon. When it's this shape, that is ascending and descending colon. Stop. Right, so what you're doing, give us the scope. Right, she's uncomfortable, too much air. right? So you've got to be careful of the air. So what you're doing is you're going forward. Is she better now? So just taking some of the air down. Better? You see? Too much air. Don't. Now you've caught the mucosa. That com that comes off, that goes on. Now you can go, do not suck, advance. Do not suck, advance. Good man. Do not suck, advance. Do not suck, advance. Good, good, good. Nice and slow. Don't suck. No point in sucking. Don't blow. No point in blowing. What are you doing? I'm stopping you blowing and I'm stopping you sucking. Okay? Don't need to do it. So keep your fingers away. Advance the scope. You don't suck and you don't need to blow. Okay? Advance your scope. Good. Now, a slight amount of air. Just a small amount. That's enough. And now look at the area. See how little you apply. Keep your fingers away. Good. Don't suck, don't blow. Where's the lumen? Where's the lumen? 6 o'clock. Good. Was it 6 o'clock? Or was it 7 o'clock? See the lumen? Get your fingers away. Advance. 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 Keep. I tell you what, if you do it again, I'll take the scope off you. How about that? That'll stop you doing it. I am watching. Good. Get your finger away. Get your... That's it. Good. Get your finger away. Good. Good, that's better. Why do you think I'm getting him not to use the air? Why do you think I'm telling him off for using the air? One, he's putting too much in, but two, because it's a way of slowing him down. And because he's slowed down, he's come all the way along the transverse to the hepatic flexure. And he's done that in 20 minutes. So he's been reasonably successful. He'd be a lot more successful if he listens. Good man. So clockwise talk, slowly. Good. You see the lumen can be seen. So what that's showing you is he's actually put the air in already. Does he need any more? No. Advance. 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 This is transverse. Yeah. Coming to the hepatic. Yeah, but we've not put much air in, so you're going to struggle to actually see and determine a difference. So he's coming to the hepatic. Keep your finger away. Good man. Advance. Advance. Good. Anti-clockwise. Good. 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 More anti-clockwise. Good. 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 Keep your fingers away. Good. Tip up. Advance. Slowly. Fingers away. Advance. 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 Keep your fingers away. You're getting excited, so your hand is closing. Good. Good man. Keep your fingers away. Advance. Keep your fingers away. Good man. Advance. If it's difficult to advance, you may need... Eric! So what's happening is that we've lost image on the monitor.
Paul, do you have scope guide there?
We do have scope guide, but what
Can
we've
we-
done is lost image.
Oh, okay.
We do have scope guide. Okay, now you can see where you want to go. Good. 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 Excellent. Well done indeed. Keep your fingers away. Good. 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 Keep your fingers away. You're getting excited again. Where's the lumen? Where's the lumen? No, it is not 9 o'clock. Yeah. So what can you do? You can stand here, straighten this arm. Yeah. Don't suck. Now advance. Good. Keep the talk on, so that's that. Yeah. Good man. Clean your lens now, so that's good. So if you've noticed, he's not put much air in. I haven't allowed him to put much air in. He's made very good progress. He's got all the way around coming up to the hepatic flexure. He just needs to slowly advance the scope. Lady's comfortable. Where's the lumen? Keep your fingers away. Where's the lumen? Sorry? Yeah. Now, what's made this procedure difficult for him is the fact that with the image that we keep looking at keeps failing on this monitor. Okay, so let me just have one little look for you. Come here and stand there. That's good, man. So, how's that been? How has that been? How was it?
Very difficult.
Very difficult? Why? See the lumen? Why is that difficult? I'm not putting any air in whatsoever.
The problem which I have is again like looking at the advanced image, I think there is some sort of resistance.
Okay. So, you see the scope? What I'm doing now? I'm just bringing the scope back. The scope is staying still on the screen. It's staying there completely. And now we can just let the scope sit and come back. You're at the hepatic, so you increase the torque. And increasing the torque enables the scope to straighten and go round the bend. Now we straighten the scope. Now all I've done is take that loop out for you. See how much air you add in? There you go. So how much air did you have in? How much air was in that bowl? Too much. So right from the beginning, you'd put a lot of air in. So that's why I kept getting you to stop. You were able to make good progress because we stopped you putting the air in. Also, you had to think about where you were putting the scope, so it slowed you down. Come back with the scope slowly. What's that in front of you? Come back. Come back. Come back. Withdraw. Stop. Tip up. Clean your lens to take the shiny bit off. Tip up. Good. Tip up. Right, where's that? Where are you? Surgical for Karachi, yes. Where are you? What's that indentation?
Indentation.
In the center?
Moid.
I hope he's...
No, no. Cecum.
So we had them all there for just a couple of seconds. So that's the appendix.
Appendix, yes.
Okay? Okay? So where's the IC valve? Okay. Centralize your view. Draw the scope back. Keep it central. Don't turn in anywhere. Keep it central and draw the scope back. Keep it central and draw the scope back. Tip down ever so slow. Draw the scope back. Now, where's the IC valve? Okay, take some air down. Suck. Stop.
Suction.
Good. Advance nice and slow now. Now slowly tip up. Don't advance, slowly tip up. Draw the scope back. Now, water, anti-clockwise. Stop, blow. Blow. I'm letting you blow now. Stop. Good man. Let's have one go for you, show you where it is. Good man. So, now you need to stand that side, because I'll just walk into you. Right, take the air down. Yeah? So as you take the air down, what you're doing is just trying to actually ease yourself to where it's meant to be, which is about here somewhere. There. You see?
Yes. The other two people. Don't know where you are.
Now we've got a little bit of irritation there.
Wash.
Wash. Thank you. So is that normal? So all normal, yeah? So when you come back, you see the appendix. The scope turns to the floor. You can see that fold. Again, you need to go beyond the fold. Think about the finger and the knuckle. As you apply the torque, the scope then sees in and goes in. Yeah? And up. Yeah? One go. That's it. Anti-clockwise. Buttons to the floor. Slowly. That's it. Slowly. Anti-clock. And now advance. 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 There you go. How was that? Yeah? Talk to me.
So it's all open. That's why it's not easy.
Oh, so he's disappointed. So come back. Now you can withdraw. Yeah?
Should I try another again?
No, come back. You've done it once. You don't need to do it again. Withdraw the scope. Take some air down. Just a little. Bit more. Good. Keep coming. Keep coming. Good. Good. Slowly. Keep coming. See how little air you'd pour in, but now we've got a lot of air in the bowel. Do you see how much air there is in the bowel and you didn't put much in on the way in? Yeah? Stop sucking. So, blow, just a touch. Don't take your eyes off the screen, because now you've dropped back a little bit. Air, 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 air. Blow. Blow. Good. See the little suction? That was you. Don't suck. A little bit of air. Blow. 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 Advance. Stop and blow. And withdraw. Good. Keep coming. Keep coming. Good. Keep coming. Your hand, yes, all the way. Keep coming. Clear that. Clear it. Suck it out. That's what I'm saying to you to do. So what you do is you take your eye off the screen and now you've dropped back. Now, just give me the scope a second, okay? Stand there again, just for a second, okay? So what you've done, overall you've done really good, okay? But what you're doing is that you're coming back and you're not paying attention. So you're in the sense that when you come to a point in the bowel, like there, you've got to clear that out to see underneath it. Yeah? Very little suction, very little. Good man. Good. So big wheel forward, so tip down. Draw the scope back. Clockwise torque. Good. Clockwise torque. Clockwise torque. Good man. Yeah? Come back. Just withdraw. Look at the screen, not your arm. Keep coming back. Tip up. Good. Yes? Do you understand it now? Yes. Yes. Good. Right. Stop. Where are we? So, okay. So, what are you going to do? Don't do it. What are you going to do? So, what are you going to do first?
Remove that further.
No, you're not. You're going to talk to the patient and tell her what you're going to do. Yeah?
पेशेंट को बताएं क्या करना है अपने आपने
Okay. So now everything again is like what you were going in. Slowly. So, big wheel back. Slow, slow, slow. Advance the scope slowly. Now, thumb across and little wheel back at the same time. Advance the scope. Advance. Advance. All the way back. Good. Advance. Advance. Clockwise torque. Clockwise. That's anti-clockwise. Advance the scope. That's it. Clockwise torque. No, you need to apply advance. Right, so now you've done it. Let's have a look. No, 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 what are you doing? No, stop. You're pushing the big wheel forward. Okay? Let go. Let go. Come here. No, no. So you don't do that. Okay? Off with the scope so it's neutral. Here. It's just going to make it look back on itself. Big wheel back, little wheel back. Advance the scope, keeping it in a straight line. Keep these coming back. As it goes in, you put the torque on the scope, and then the scope will actually look back on itself. Okay. See? Large hemorrhoids. Yeah? Let the scope off so it comes straight. Take the air down so she feels comfortable. Ask her how she is, and then you take the tube out. Yeah? If you just take it, do it and take it out, she'll remember all the pain.
In this way, what we used to do, we just move the both wheels back
Yeah.
and then advance the scope and just move the anti-clockwise.
Yeah, the problem is that if you do that, that is actually low down at the rectum. So now all of a sudden the rectum is here. So do it now. Right? That's into the, look at it digging into the rectum. See it?
I have learned from my seniors. We used to do in this way.
Okay, well I'm showing you a different way. As I said to you yesterday, you'll be shown different ways of doing things. And then it's up to you to decide which is the way that you need to do. This, just inside the rectum. So do it. But look what it's doing to the, and the big wheel back, all the way back. Look what it does. Then you push in and the scope digs in. Okay, now, this is the rectum. Okay, so, advance. Now, big wheel back slowly. Advance. Little wheel back now at the same time. Advance. All the way back with both. Advance. How much catching is there?
Can we use
How much
both
catching? How much did you actually hit the lumen wall doing it that way?
hands?
Less. Do you want to cause pain or do you want... No. So, up to you which way you use. You can continue to do the way your seniors have shown you, or you can do the way that we're trying to
Yes.
suggest.
Just learn.
So what we need to do is make her safe. There we go.